Hey guys, thanks for stopping in. I've made several videos now about chronic pain patients, chronic pain sufferers, and how hard it is to get pain medication now because of all the the DEA laws and the cracking down, the war on drugs, all that stuff. And I probably get comments almost every day, well maybe not every day, but every week on, I don't know how many videos I did on that, probably 2 or 3 videos, maybe more than that, but there's mainly two or three videos where I get comments on pretty much every week, and it's always the same thing. People totally agree with me. They're chronic pain sufferers. They're not being able to get their medication. They're just getting cut off. They're miserable. I've already had 2 people now say, one of my family members committed suicide. So that's 2 people right there that I know of. Is that they couldn't get their pills, they couldn't function, they couldn't handle it, and they off themselves. So you got to wonder how many other suicides there are because of all this war on drugs thing. And I get that there's a drug epidemic and stuff. I mean, I see all that on the news and stuff, but what about people like us? I mean, I've had chronic pain for years and years. I have thoracic outlet syndrome. Probably had that close to 40 years now. That affects the nerves and the circulation in my shoulders, my arms, my neck. Also have lower back issues. I've had 3 lower back surgeries. A little over 5 months ago, I had a double spinal fusion. It was 2 levels, 2 surgeries. So I've had chronic back pain for 25, 30 years now. So that's my 3rd surgery, and first 2 surgeries were kind of flops. They didn't help me. So, I've been taking prescription narcotic painkillers for probably 20 years, and they still help me. I just take basically the prescribed amount. I don't go over my prescription amount, and I do fine with it. And I've had many other comments from people just like me saying the same thing, and it's just so frustrating that no one seems to care about us. We're just kind of getting pushed by the wayside. It's like, got to stop that war on drugs, got to stop all these people dying and overdosing, all the drug addicts, but what about us? Nobody seems to care about us. In fact, I'm even getting comments from veterans, people that served our country. And here's the thing that bothers me about that too, and correct me if I'm wrong. I don't like to get into politics, but I see all this big thing now where people boycott the NFL because these players are not standing for the national anthem, and it's disrespecting our military and our veterans and all this stuff. Yet why am I getting veterans commenting on my videos saying no one will take care of me? I can't get any painkillers, I can't get any pain relief. I mean, isn't that kind of hypocritical when people are saying, these veterans are saying, I served the country and now I can't get any help? I mean, come on. And like I said, I'm not a veteran, so, correct me if I'm wrong on that, but I'm just talking about the comments I'm seeing and getting from people, and, that's what they're saying. So, I don't really know where this is going, this thing with drugs, but, people always say, man, I appreciate you speaking out on this. Well, the problem is, most chronic pain people, they don't feel good enough to even get out of bed a lot of times. So, a lot of people are saying that, without my medication, I can hardly get out of bed. Well, you know what? I've been there where for years all I could do was stand or lie down. And I used to lie down a lot of the day because of back pain, because of neck pain, because of shoulder pain. I couldn't get comfortable. And over the last say 7.5 years now, I've actually improved quite a bit to the point where I can get up and move around quite a bit more. I'm not pain free. I'm a lot better than I was. And, you know, people say, oh, you need to try, you know, all this other, you know, alternative methods other than drugs, you know, for pain management. And I do. I've found things I can do, like vacuum cupping, self-massage, joint mobility. And, you know, they say, you know, stuff like acupuncture and this and that. But stuff like acupuncture, you got to pay for. And most people can't afford to, you know, go do that. Stuff like vacuum cupping, I could buy a set. I have like 3 sets now, 3 cupping sets, and I could just do that myself. So I could buy a set for like $30 and work on myself. And same with like self-massage and that kind of stuff. I can do that myself, but even that doesn't, I mean, it over time it's improved the pain, but I still have days when I am in pain or I did too much or this or that, and I still, you know, try to get off painkillers the best I can, because I'm just waiting for that day when they're going to say no more at all. In fact, I dread the end of the month, every month, when I have to make that phone call to refill them, because I'm just waiting for when they say no, you know, no more. It's, you know, you always get the runaround. In fact, even when I had my back surgery, when I was in the hospital, my fusion surgery, they said they tried a few different painkillers in the hospital, said whichever one works best we'll send you home with. So they're like, which one worked best? I'm like, Percocet. So what do they send me home with? Norco. I'm like, wait a minute, the Norco didn't work that well. Why are you giving me that? Well, yeah, it's something to do with, I don't know, it was too much for my liver or some BS thing they told me. So I ended up just having Norco. And even my family doctor that was prescribing them, he said, are those even strong enough? I said, well, they're borderline. I guess, you know, I'm not going to get the Percocets. So it's just what I had to go with. But, you know, it's like, anytime you even bring up needing more pills or stronger pills, you get looked down upon. It's just a huge hassle. So that's my my rant, my video for today. Thanks for watching, you guys, and I'll talk to you next time.